Portland City Council. Today's date is June 15th, 2023. Welcome, Lisa. Why don't you go ahead and start us off?
Thank you. Good afternoon, Council, Mayor, Bureau Directors, community members joining us today. My name is Lisa Freeman, and I manage the Alternative Response and Prevention Unit within the Community Safety Division. Just want to thank you so much for joining us today and taking the time for this public safety call allocation work session, and we truly appreciate all your support for this project to this date. So to set the context, you know that jurisdictions nationwide are reassessing public safety response methodologies. Traditional responders are overwhelmed with an incredible workload and a breadth of calls that they've never had to respond to before. And cities are also considering how alternative, non-traditional responders might be able to alleviate some of this workload, while also providing more appropriate responses to certain types of calls. And so with this in mind, 2 years ago, Council established the Community Safety Division in 2021, and you gave us 4 action areas. Build alternative emergency service models, send the right responder to the call, align governance with goals, and reduce the need for public safety response. And so to advance those first 2 action areas, build alternative emergency service models and send the right responder to the call, CSD began work on a call allocation staffing study. And in October of 2022, after a competitive and transparent process, we selected mission critical partners to implement this study in 2 phases. The first of which is call allocation, which is what we're here to talk about today, looking at all the calls coming into the Bureau of Emergency Communications. How are they currently allocated to different types of responders? And is there or are there better ways to allocate those calls? And then the second phase is looking at staffing. How many and what types of responders are needed to respond to all these different calls for service? So we're here today with Mission Critical Partners to review the key findings and recommendations from that first phase of work on call allocation. We do intend to return again in the fall to present on the second phase of work on staffing. So we have 90 minutes together today, and our agenda is pretty simple. Soon I'm going to turn it over to Bonnie Maney and Gigi Smith from Mission Critical Partners. They're going to provide an overview of their work thus far, highlighting key findings and recommendations from Portland's call allocation, both operations and policy. And their presentation is about 30 minutes. And then following that, Director Myers will take about 10 minutes to present some proposed next steps for how we could implement Mission Critical Partners' recommendations. And we have allocated over 30 minutes for questions at the end of the session, so we do ask if you can please save your questions until the end. We should have plenty of time to answer questions. So now I will turn it over to Bonnie Maney from Mission Critical Partners to kick off their presentation.
Great. Thank you, Lisa. If we could have the next slide. Not sure where it is. Okay. Good afternoon, City Council, Mayor, Bureau Chiefs, Directors, and community members. As Lisa mentioned, my name is Bonnie Maney. My public safety communications career spans about 34 years, with the past 12 as a consultant, working a variety of issues at all levels of government across the country. I'm the operations manager, domain manager actually, for Mission Critical Partners, which means that I lead teams as a senior advisor, working a variety of really important issues, such as that we've been working with you all on, which is alternative response. We appreciate the opportunity and trust that you all have placed in Mission Critical Partners. We look forward to working with you during this working session along with the CSD team. With that, I'm going to turn it over to Gigi to do her introduction, and if you could move us forward in the presentation.
Thank you. Hello again. See if that's close enough. I'm Gigi Smith, and my public safety career spans about 36 years. I started as a call taker dispatcher, worked my way up through the ranks until the time of my retirement, where I was in executive leadership for the largest consolidated center within the state of Utah. For the past 3 years, I've been working in the private sector on the public safety side, where my experience has ranged from AI to protocols to now in my current position as project manager with Mission Critical Partners. Mission Critical Partners would like to acknowledge everyone who contributed to this report in ways big and small. As you see from the slide, there are many who deserve the thanks.
What slide?
Yeah,
Am I
what
missing
is
something?
the slides?
Slides, yeah.
Do we have?
What's the slide deck with the clerk? Do you have a slide deck?
The clerk?
Keelan, it's all up to you. Here comes some.
Okay.
Are you the keeper of the slide
Yes,
deck?
that is,
I can
yes.
email it to Keelan.
Okay,
Perfect.
thank you.
Thank you.
Good.
That's necessary?
Okay, so just be a little more descriptive until we
Yes.
Until we catch up.
do it with
So
fervor.
on the slide, there are numerous names, and they all deserve many, many thanks. At times, tough topics and conversations were had, but that was a way of understanding the situations in order to offer long-term resolutions and not just temporary fixes. We appreciate the opportunity and the trust that the City of Portland has placed in MCP to serve you. Now we will be going to the next slide.
So I have to join Zoom.
Okay.
Okay.
And just to clarify, are we talking about the 26-slide presentation that we were emailed earlier? So I still don't know that the slide she was just describing is in that deck.
That was on the acknowledgements. That would be,
Oh,
Oh, I
So
see.
we
Okay.
all have the hard
Got
deck,
it.
but
Okay.
people viewing it won't be able to see it. So I guess for
Sure.
the time being, until we get it up, we can see what you're describing. The public just can't.
I'll share with you. Dan, it's right here. This is what she's
so I'm currently on slide number 4. And while we know that each of you are familiar with this project, we would like to take a moment and provide some context by sharing a little bit about the goal of this project
found it in
and
my
the
email.
methodology that we used. As Lisa already noted, in the fall of 2022, Mission Critical Partners was engaged with the City of Portland's Community Safety Division to perform a public safety provider call allocation and staffing study. Specifically, MCP was asked to perform a holistic assessment of the types of calls dispatched to public safety service providers, and then evaluate the number of public safety service providers that are needed to respond to the different types of calls based upon the first assessment. In order to provide you with the call allocation study results today, MCP's strategy was to learn directly from each of you by hearing the thoughts and the ideas of the stakeholders and making sure that we spent time with those in the community so that together we could explore what other options may be out there for assigning, triaging, and responding to calls other than what has traditionally been a default to police, fire, and EMS, and essentially seeking to right-size the work for the public safety environment. Moving on to slide number 5, which is methodology.
Okay.
MCP completed a comprehensive schedule of 61 key information interviews, focus groups, and community voices listening sessions, where we asked a standardized question of 9 questions. You can review the themes and the trends resulting from these conversations in Appendix A of the full report. The goal for each audience was to offer the attendees an opportunity to share what was on their minds, and in turn allow MCP to use the information to build a strategic foundation for optimizing emergency, non-emergency, and alternative responses as it relates to call allocation. We used this early information to develop the community survey, and you can see those survey results in Appendix B of the full report. The focus of the community survey was to seek the community's input on 2 areas. 1, when it comes to fire, medical, and police response, what are the community's priorities? And 2, what are the community's specific needs in requesting and receiving services that may involve mental and behavioral health, housing insecurity, or other safety-related but non-emergency situations? Outcomes from these important components offer the city an opportunity to learn directly from the community members about how call allocation and resource dispatching influences their decisions when seeking assistance and what changes they think should be made to the system. As we move forward with our presentation today into the current state, you will see that the data and the information we worked with range from hard numbers or quantitative data to opinions and anecdotal input for qualitative data. For data that was quantitative, MCP relied on established public safety and private industry metrics to assess and evaluate factors related to public safety. Where data was qualitative or metrics had not previously been established, MCP drew on its collective industry experience and awareness of best practices to create those metrics and then assess. Next slide. And then moving to slide number 7. While there are a total of 20 key findings noted in the full report, today we will be presenting 11 of those that were the most influential in developing the recommendations that Bonnie will be sharing with you shortly. We begin the more qualitative findings on this slide with our first key finding being that there were more than 60 city, county, and state alternative programs or resources that exist, and that some of them are more siloed than others. These alternative programs are in desperate need of change management and a citywide coordination framework if they are to be effective. Our second key finding is regarding data. MCP found that there are several local along with national known constraints that exist with data that currently limits the ability to accurately ascertain desired key measurements, such as the data may not exist, or if it does exist, it's inaccessible or in disparate locations, or that it may be too early in a program's existence to acquire, evaluate, or draw any conclusions. Our next finding is addressed as level of effort and highlights that future opportunities, considerations, and recommendations, while considerable, do not advocate for an entirely new set of call types or nature codes. Rather, the recommendations suggest increased modifications to address call types and nature codes, priority levels, and policy and metric gaps, with the intent to improve coordination and meet public expectations for adequate response. The last key finding on this slide identifies that there are multiple alternative response policies that reflect practices for decision-making, authorizing 911, 311, and other resources to receive requests for service. Having multiple disparate policies increases the risk of policy conflicts and confusion. Additionally, many of the existing policies are prescriptive and default to traditional unit allocation. Next slide. Continuing with this slide, it transitions us from qualitative findings to more quantitative. The first key finding that you see on this slide highlights some of the results from the community survey. Of note, 65% of the community expressed apprehension when contacting 911, indicating if they call 911, they assume that they will be getting traditional fire, medical, or police response. 32% questioned their trust of the 911 call taker to make the determination for a proper responder. This may suggest that perhaps the public is unsure of the level of training, experience, knowledge, and expertise that is obtained by 911 professionals. Also from the community survey, 69% of the respondents agreed that when a crime is committed, alternative responders are not what the public expects for a response. The next key finding is regarding nature codes. Nature codes can be defined as a code that references a situation or an event requiring services, such as a theft, an illegal burn, or a sick person. We found that there were approximately 4,500 of those nature codes. We found that the top 25 nature codes make up 46% of all CAD incidents. Moving on to the next key finding, in 2022, BOG received over 1 million calls. Approximately 340,000 of those calls were received on non-emergency and administrative lines. That amount of calls equals 32% and are more than likely priority 6 and 7 incidents. Priority 6 and 7 incidents are two of the lowest priorities. Regardless of the source of the call, police priority 6 and 7 incidents were found to make up 27% of the total CAD incidents. Next slide, please. As noted on the previous slide, the top 25 nature codes represent 46% of the CAD incidents. 44% of those, or 124,622 of the top 25 nature codes, may possibly be eligible for alternative response, which totals 20% of all CAD incidents. MCP then broke it down from there and examined each discipline, fire, medical, and police's top 12 nature codes. The amount totaled 42%, or as you can see highlighted, 258,727 incidents that were dispatched. To further explain, 14 out of the 36 nature codes accounted for a total of 49% of incidents that may be eligible for alternative or co-response. And now lastly, of the key findings being presented, based on the 311 implementation plan, it is projected that 311 could reduce BOEG's call volume by 180,000 calls, or nearly 17%. Please note the 33% on this slide, and on the next slide we will share what that means. 33% is an average of the data points that you see on the screen. These data points take into account call, CAD, and survey data along with the 311 projection. And then we, MCP, average, and it suggests an initial eligibility goal for alternative response of 33% of incident volume. I'd now like to turn the time over to Bonnie to share future considerations.
Thank you, Gigi. And good afternoon again to you all. As we transition, if you could go to the next slide, please, sorry. And one more. Thank you. As we transition from the current state to the future, we begin by sharing with you some information about 4 items that are very important to the setting of the stage for MCP's recommendations and are related directly to Director Meyer's presentation. In response to the findings and for your consideration, MCP has proposed a respond, resolve, restore approach that is comprised of 2 symbiotic elements: first contact response, or FCR, and Community Services Response Network, CSRN. A respond, resolve, restore approach for allocating calls for service does 3 things. First, it shifts the collaborative mindset toward measuring workflow efficiencies as they relate to having the right resource respond at an individual's first contact. And second, even though it's not in the scope of the study, through these efficiencies, the foundation is set for the right resources to help resolve and ultimately restore the situation. And third, while restoration may take minutes, months, even years, those in need would be on an upward trajectory as it applies to individual community-related service needs. Next slide, please. The first of these elements is first contact response. And with this respond, resolve, restore approach, this concept of FCR promotes timeliness and equitability for all calls for service. And it does this through the expectation that an individual seeking assistance would receive an adequate response as they define it on first contact, if that's electronic, or by not having to talk to more than 2 people. First contact response also approaches service delivery and call allocation differently for the majority of calls coming into the system that are not considered real emergencies. And unlike traditional approaches, first contact response is focused on measurable processes and procedural improvements rather than outcomes, which are sometimes unpredictable. This approach seeks to engage in trauma-informed care and harm reduction from the point of entry into the services network, regardless of where that service enters the network. It could be from 911, 311, a non-emergency, 10-digit number, or even the Community Services Response Network. First contact response also commits to call flow efficiency and consistency that includes a pathway to a known landing point or space for persons seeking assistance. These pathways seek to provide voluntary opportunities and intercepts to connect those needing assistance with services that are capable of actively taking steps that can lead to resolution and restoration. Next slide, please. Okay. Moving on to the second of the elements is the Community Services Response Network, or CSRN. This network is a collaborative network of teams, programs, and services that specialize in providing community-based responses to calls for service in coordination with, or actually independent of, traditional fire, medical, or police response. The approach MCP is putting forth for your consideration actually necessitates developing, formally or informally, a community services response network. On the left side of your screen, you'll see more clearly the graphic that represents the first finding that Gigi highlighted, noting over 60 different access numbers and services identified during the study. What looks like a spaghetti bowl represents an uncoordinated, no wrong entry point, but also no clear path to response, recovery, or restoration of the current state. The diagram on the right, however, presents 2 options for your consideration for accessing the resources. Essentially, either implementing a 2-number or 3-number coordinated access system with a clear path to response, recovery, and restoration. This approach seeks to provide coordination and reduce the access points to no more than 2 or 3 easily rememberable numbers. The diagram in the middle with the orange doors shows a 2-number system using 911 and 311, while sharing the responsibility for the community services response network resources. And then the one on the far right with the green doors uses a 3-number access system using 911, 311, and a repurposed number, such as 211, that would be assigned to the community services response network. A key to the success of either of these options, though, is the 24/7 accessibility of the services. So now there's been concern expressed that a 3-number system would actually be adding complexity. However, to be clear, the 3-number access approach is not advocating for a new number. What it is actually suggesting is to explore if the opportunity and the capacity exists within the current numbering system, if there is a number that would be able to be allocated to be able to access the community services response network. Now, a number that has been proposed in the past in the 311 implementation plan for such a service that does community and health services is 211. Now, programs such as those that exist in Albuquerque, New Mexico, are showing early success with a 2-number access model. However, based on the feedback received from the community, we think that a 3-number model may actually be more successful in Portland. And this is because while both systems will provide professional access to emergency services, the 3-number system more directly reflects the community's desire for direct access to alternative responses, and does address some of their apprehension that there may be for contacting 911, but while still having a direct path to emergency services if needed. Next slide, please. Lastly, before we move on to the recommendations, we want to mention that while MCP did not evaluate all of the 45 or almost 4,500 nature codes for their specific eligibility for alternative response, as the findings noted, we did review nature codes that make up 46% of incidents. Across the existing alternatives, several practices and response options have already been agreed upon. You can see these in policy documents, planning documents, and online. What you see here on the screen is a graphic that represents a methodology and tools developed by MCP for building a nature code profile that can be used to help validate and assess if a nature code is eligible or not for independent community service response network resource allocation and/or a co-response with 911 and 311 resources. This approach provides consistency and can be applied across all nature codes. The first 2 steps mention the primary tools used for building the profile and for evaluating the nature code. Once a decision is made, steps 3 through 6 then comprise the important administrative, technical, and training steps so that resources are allocated and metrics are tracked consistently. Next slide, please. And one more. Moving on now to our final slide for MCP's portion of this presentation, we'd like to present to you our policy, operations, and technology recommendations. Before we discuss the specific recommendations, it is important to acknowledge that there is not a magic solution to this challenge. The public safety ecosystem will continue to evolve, like it always has, and the public's expectations of level of service and adequate response will constantly be changing along with it. Based on the analysis, however, MCP developed the following set of 3 policy, 6 operations, and 1 technology recommendation that construct the alternative response call allocation strategy to address the inefficiencies and challenges within the current state, focusing on long-term sustainability. MCP placed these recommendations in a suggested priority order, with the top 3 being to first, leverage the CSD to provide a change management framework to streamline, coordinate, and detangle the existing services that continue to be introduced into the ecosystem. Second, align current call allocation practices with policy, and as alternative to the multitude of one-off policies, draft a singular alternative response policy that reflects the actual practices, supports decision-making, and authorizes 911, 311, and others receiving requests for services to apply alternative response. And third, develop a centrally located, coordinated community services response network for resources that can be dispatched to respond to calls that do not require traditional 911 and 311 services. AMCP is confident that all 10 of these recommendations have a role in the successful strategy. However, they are not intended to be completed sequentially, nor all at once. Where it is in the best interest of implementation, recommendations may be reordered, combined, and conducted in parallel. It should also be noted that in the report, these recommendations include additional detail, suggested action items, and articulate anticipated outcomes for each. Implementing this strategy by first addressing the top 3 recommendations to provide that framework to improve coordination, apply practices with policy, and develop a community services response network, and then align this strategy with the future strategic planning initiatives is anticipated to accomplish several things. First, improve emergency response, help improve call flow, reduce unnecessary contacts with fire, medical, and police resources, and increase accountability for the outcomes of decisions made by users of the systems, all of which are anticipated to contribute to CSD's achieving its goals to build alternative emergency service models, send the right responder to the call, and reduce the need for traditional public safety response. Before I pass the presentation on to Director Myers, who will be speaking, as noted, on CSD's proposed next steps for implementation, we would again like to thank you for this opportunity and look forward to answering any questions that you may have once Director Myers is finished. Right?
Thank you, Bonnie. Next slide. Mayor, Council, for the record, my name is Mike Myers. I'm the Community Safety Transition Director for the City of Portland. Before we get started, I want to thank you, Bonnie and Gigi, for all of the work that you've been working on over the last year or so. This isn't easy work. You provided a very technical report, and part of my job, Mayor and Council, is to kind of break that down into some recommendations that the Community Safety Division has, and I'll be getting started on that shortly. I think it's important to know that when we hired Mission Critical Partners, the landscape of call reallocation is not new. There's been a lot of discussion around the country around looking at police calls for service around mental health. You're aware of that. Most cities are looking at that type of call allocation. However, we asked them to do a more robust look into other opportunities to do call reallocation for police, fire, and medical, and to look at all calls that came into 911 services around the country. This is rare work. You will not find too many cities that are conducting this level of investigation into total call reallocation. In fact, I couldn't find any others, which lends to your credit for taking on such what I think is important work here in Portland. And I'm sure across the United States, you're going to see this evolve quicker over the next coming years. We are not alone in the inundation of 911 calls to a 911 center. Bob, that's national. That's Director Causey will confirm that's a national issue, where we are not alone in the amount of call volumes that a police bureau or department faces, and the challenges that they have to staff those calls and to get officers to those calls, and the same is occurring in the fire service. So we are undoubtedly taking the first steps here, I think, not just nationally, but inevitably we will be taking them regardless of if we started to work on this now or later. I want to thank Lisa Freeman and her team from the Community Safety Division. We started work together as was one employee on April 1st, 2021. Lisa made 2. We've been working not only to do the other work with CSD as far as consolidating the public safety team together, but at the same time, Lisa, thanks for taking this challenge on and bringing it to the finish line today. I want to thank Chief Lavelle, who I believe has joined us online. Chief Frome is in the audience. Thank you, Chief. Chief Boone and Chief Gillespie here present. Director Causey, thank you for giving your time with us on this very special project. Shad Ahmed, President Aaron Schmaltz with PPA. Thank you, Aaron, for your candid conversation, your commitment to be here as well. And PFFA President Isaac McClellan, I think, is in negotiations right now. We appreciate their team. And Michelle Koenig-North, who's a very important part of this discussion, who's the manager, mayor of the 311 team. Let's start off with the first slide of the recommendations, if we could. And let's start here. Yes, thank you. And Angela, thank you for helping us save the day with the slides that we appreciate you always. Mayor and council, I think it's important for me to start out saying this. When you'll hear a lot about the Community Safety Division. My title is Community Safety Transition Director. That suggests we are in a transition. I would like to look at this study and the recommendations that we are about to propose from the Community Safety Division in the greater context of the charter reform and where we are headed over the next 1.5 to 2 years together. It should be self-evident that the current state of the Community Safety Division would eventually transition into whatever we are building together. You would have a police bureau, a fire bureau, 911, Portland Bureau of Emergency Management, and then I likely you would continue to have an alternative response and prevention unit as well in there, in that team. The current division as it sits today would go away. The components would still be there and be plugged into the new framework under, if you choose a deputy city administrator or however you plan, however we all decide to frame this up, but the actual division would go away. So there might be some hesitancy today from council on making moves of any significance early while it's still a division prior to having a more permanent manager or director in place in some time in the future. So I'm considerate of that, and I understand the timing that we are in. However, there was no delay on getting the work done that you assigned us to do in 2021. We took those steps. Let's get started with some recommendations. Again, this was a very technical report. It was intended, there's really no way around that. The report was really written for people like me, people like Bob, people like the fire chief and the police chief who are work in this technical framework. So I would like the opportunity to kind of break it down, their recommendations down to recommendations that I'm proposing today, strengthening some of the recommendations that they proposed. The first three, you see them in a aqua color on your screen. The first one is to create a community services response network housed in Community Safety Division's alternative response and prevention unit that Lisa Freeman manages very well. You were all actually, she manages OVP as well and Safe Blocks, and thank you, Commissioner Rubio, Commissioner Ryan, Mayor, for being at the kickoff today for the ceasefire model. Lisa works very closely with that team as well, and Lisa, thank you for that. The creation of a network, as MCP pointed out, which this surprised me, and I've been in the business for 37 years, that we have 60 potential opportunities out there for providers of something, some kind of service that the city could utilize. We don't know who they are. We don't know their capacity. We don't know what they do, how they can respond, what their depth is, whether they're financially stable, or would they be willing partners and how much it would cost. But we should bring them, vet them, investigate this opportunity, and bring them into a network of solutions for us to take, as we take calls in, we have these other options, and we want to put them into a network. And we are, thank you for picking the term, Mission Critical Partners, the Community Services Response Network. That's what we're calling it. The second bullet is an important one. This by no means is suggesting that you must move, or literally move, PS3, PSR, chat, or these other internal service models from their bureaus and reposition them somewhere else. You can, that's not what we're suggesting. We are suggesting that they need to be part of the total network, that we also own alternative response opportunities here in the city of Portland, and we have our nonprofit and other partners that we would like to have in the network as well. And then, of course, the bottom one was self, I think you talked about that already, that we would coordinate those. Next slide. Second proposal is that task the Community Safety Division to work within this community safety or community services response network to coordinate and align policy development. If you have 60, and I don't know that at the end you would have 60, you might, as we vet them, we might say like 40 or 30 groups actually work. We can't have 30 different independent policies. And we would want to see one common policy that we all kind of worked on together. Lisa, you and I have talked a lot about this. Any other comments? I want to make sure that we talk to them about if, as we're designing policy, we're not, we want to eliminate overlap and things like that. But you and I have discussed about this policy. Can you kind of talk about that a little bit here?
Yeah, so Mission Critical Partners mentioned that they identified a number of different policies that exist that were created in a one-off fashion. And so this is really a recommendation to identify, look at the different policies and align them in one policy to fill the gaps with that policy. And our recommendation is simply that you task the Community Safety Division to take the lead on that alignment and working with our bureau partners on it.
Thank you, Lisa. Next slide, please. We appreciate Mission Critical Partners' comments. We went back and forth often about whether we picked 3 numbers or 2 numbers. There was a couple of commissioners that want to keep it simple. We want to focus on a lower number of number types that the city has. You are all aware of the North American numbering plan. We have 211. 211.org is a official and a formal resource that exists here in Oregon and certainly here in Portland. We use it regularly in emergency management. It is a path forward for many different services that the county might have. We have a 311. Michelle Koenig-North's here somewhere. Hi, Michelle. You're welcome to sit up front if you'd like with us. Very important player. We're going to have a lot of demands if we do this on 311, which means we would need to be at a 24-hour 311 service. Of all of the cities that I looked at, Aaron Schmaltz from PPA, I looked at all of the cities that we do comparables for, we negotiate. I looked at the gun violence cities that we compare our rates with. Every one of those cities have a 24-hour operational 311 system, except for Oklahoma City that has an action center. They don't call it 311. But all the other ones do. That's Seattle, San Francisco, Minneapolis, and the number of different cities that we use to do comparables. So we have 311, 411, 511, 611, 711, 811, 911. All those numbers exist. Some you call for underground wire and utilities. Some you call for travel information. We specifically advertise and promote 311 and 911. 911 for emergencies, 311 for non-emergencies, and that would be our recommendation. The Community Services Response Network would be the actual notification, that network, that database would be housed, our recommendation is to house it in 311, so that non-emergency notification could occur through that number. We do a little bit of that already, Bob, I think, where we have some 911 calls, anything that's not some non-emergency might have to go to 311, and vice versa. If 311 is to get something that needed a 911 response, that would be put over to Bob.
Director Myers?
Yes.
So I know we went from like bank hours on 311 to expanded hours. I know it's not 24/7. What are the actual hours again?
Michelle, can you come to the front and maybe talk about the hours, kind of where you're at and your staffing and that kind of thing?
Me too.
And thank you, Michelle, for being here. Appreciate you.
Hi, Commissioner. Michelle Koenig-North, Program Manager for the City of Portland and Multnomah County 311 program. We currently operate Monday through Friday, 7 a.m. to 8 p.m. We, however, have recently hired a number of staff and will be expanding our hours to 7 days a week, 7 a.m. to 8 p.m., beginning on July 1st.
So currently it's 5 days a week.
Correct.
Okay. Everyone loves 311. Thank you. Yeah.
Thank you, Michelle. Next slide, please. I had purposely invited PPA and PFFA here at the table today. They were contacted by Mission Critical Partners. They were a cooperative partner. They played a role in our in Mission Critical Partners' recommendations and ours. I wanted to make sure Aaron heard this with me in the room. I have talked to Aaron about this on the phone, that we are not recommending, we are not implementing anything here today. We are not telling you we are going to implement anything. We are making recommendations on what the potential is. I think Aaron would I think, acknowledge this. Any removal of a work unit, any removal of additional work to a work unit, or removal of work would require negotiations. We do recommend that if we are going, we do recommend reallocation of work, that there is a significant potential percentage of calls that could be reallocated. If we do that, if that's of the interest of the city, and I believe it should be, then we would need to negotiate that with the locals, with the bargaining units. I think that's it for that one. And next slide, please. We have, in my opinion, I was your fire chief prior, this is where I developed this opinion. We have done a very, very, very good job in Portland on advertising the 911 as the point, the place you call if you have an emergency. So much so that people call for everything to 911. And it has not assisted Director Causey with his workload. It's caused a great deal of difficulty, actually. And although Michelle Koenig North, I think you have been preparing to embark on a robust media package, we would like to recommend today that we continue that we need to change caller behavior. And people need to be instructed on who to call for what, and we need to start that. It would need to be ongoing. Call 911 for emergencies, and then non-emergency calls through 311. And that'll be a heavy lift and an ongoing one probably for our lifetime together here as a council and staff. Next slide. So, Mayor and Council, I've talked to each one of you, at least your staff members, a couple of weeks ago, and I told them, here's what we're doing, and what the goal of the presentation would be was to really, stimulate dialogue. I wanted this to be a good work session for you. This would be a big step for the city to actually start looking at reallocating these calls, and it could be impactful. And there's a lot of interested parties here at the table on how that might work. I am not suggesting today that I have agreement from Chief Boone, Chief Lavelle, Director Causey, Director Ahmed, Aaron for PPA, or Isaac from PFFA, or any of you. You may not agree with, I don't not have total agreement. And I want to be clear that this is an opening rounds of discussion on where do we want to go as a team, how can we help each other, if police leadership and fire leadership and the 911 director is struggling with workload, if that workload is driving staffing issues, if that workload is driving delay issues, we should probably address the fact that the workload should not drive us. We should be managing the workload. And that's my suggestion, is that we have that dialogue, and if there's interest, take the necessary steps. Thank you for having me here today. And again, I want to thank the team at the table for helping us get to this point. And I would open it up for questions.
Very good.
A series I can.
Why don't you go ahead and start?
Well, thank you guys for a comprehensive report. This is very, very insightful. I'm going to have a lot of questions, but maybe I'll go through a first phase and then let my colleagues chime in. First of all, I appreciate the observation on the importance of charter reform implementation, the uncertainty around the long-term structuring of public safety, and for that matter, social services that the city's involved in, and that we still have some work to do to define what 2025 looks like in terms of a city, and that has some direct implications for parts of the recommendations here. Second, the council did adopt in our most recent budget some specific budget notes that address allocation of public safety calls that I think we will need to reconcile with your recommendations, because we just addressed this at some level. So I just want to avoid duplication of efforts, and that we're being as efficient as possible as a city as we kind of think through some of the questions you're asking here. I want to level set on one piece with respect to CSRN, if I've got the acronym correct. Is it fair to say we're not aware of any such network in the country, or what is unique in terms of what we've done here? And just want to level set as to what exists elsewhere based on your findings, and what are we entering into new ground here?
Right, thank you for the question. The closest one would be the one that we referenced in the presentation, that'd be Albuquerque, New Mexico. They do have a form of a community services response network. Theirs is accessed, though, through their 911 system.
Okay.
However, again, based on the community's response and the feedback that we received, I think what Director Myers mentioned about having it accessed here through the 311 would be probably a good positive step in that direction to address that. But Albuquerque, New Mexico is probably the only one that has anything near what you're talking about. You'll see the mobile crisis units, types of PSR, types of programs, but with the community response network, they're probably the closest.
And I say that, or ask the question, looking at the city of Portland's history, our state's history, we're often innovators. We often try things new. That's a good thing about us. We are also dealing with some of the pains of some experiments we've tried recently, including at the state level, Measure 110, a number of other issues that touch on public safety, that touch on social services, that sometimes have had unintended consequences.
Sure.
And then I don't want to sound concerned about that, but we have some experiences locally of being the guinea pig that aren't always pleasant. And I want to dig in then on a area specific around 311 and its current capability. So whether we're talking about a 3 number or 2 number, I think some of the issues are going to be the same. So currently 311, not 24/7, not 7 days a week, but we anticipate it will be 7 days a week starting in July.
Correct.
Got it. And will we have holiday coverage after July 1, or is that still on the path?
We are anticipating that would happen within likely the next fiscal year.
Next fiscal year. And then is it currently envisioned that 311 dispatchers, well, let me get back to the word dispatch. 311 call takers will be trained in medical dispatch, for example? Will they obtain any kind of certification?
No, our call takers are currently not trained, and we had not anticipated that in the implementation plan that was brought to council for the 311 program.
Oh, and so I would just put that out as a note that I think we should circle back to this specific point when we're talking about anything medical, including, for example, chat that might go through this alternative network, whether that's through 311 or a number, you need someone to make the call as to who's the appropriate responder. Currently, that requires someone who's trained in medical dispatch. And so if we're calling in on another number, I just think that's something we need.
Yeah, I think that's a really good point, Commissioner. Just to kind of clarify, I think there's on any individual decision to make a call to the city of Portland for help. If we have 2 opportunities to create some efficiencies and I think increase productivity for the city. 1, if we have a decision to call, and I have a non-emergency, I can make the decision to call 311 based on how I've been marketed to, right? How I've been explained who to call. We need to do a better job of that. We all know that. That's okay. But we have an alternative to call 311. That's the first thing in helping Bob Causey, the director of Portland Bureau of Communications, manage his total workload where people make a choice to call for an emergency or make a choice to call for a non-emergency. And not always would it be medical. There are so many other things that Michelle Koenig North deals with at 311. The second opportunity for efficiencies are, even if the caller calls 911 and it's a non-emergency call and a call taker takes the call, Director Causey's staff takes the call, and the decision is made this is a non-emergency call, And originally, let's say fire would have ran the call, or maybe police would have ran the call in the past, or somebody else would have taken the call. And we have some other group that we've identified that is in a database, which is another term for CSRN, just a database of contacts. That call could be transferred rather than to traditional services to that other provider. And the person that would actually, they would transfer from 911 to 311 and 311 to the other provider. That lends to jeopardy the 2 points of contact you talked about in the first contact response. We want to eliminate as many contacts for the resident as we can. We would like to have a one-stop shop. It's literally not possible unless the person makes the exact right choice to begin with, which could be difficult. You know, it could be difficult. You don't know what's an emergency to you, may not be emergency to you or you. So we don't know for sure. That's where that marketing comes in. We have to do a really good job, and that'll help. But I think those were the two options that we have. Michelle, did you want to comment on that?
Yeah, if I could speak a little bit more on your question, Commissioner, and I appreciate your distinction between the call taking and the dispatch component. We get calls at 311 every day of folks who have called us, and they're not quite sure if they should have called the public safety non-emergency line. We don't get quite as many calls of people confused between 311 and 911, but our staff frequently have callers that they then say, you know what, this is an appropriate call for the public safety non-emergency line, for the police non-emergency, or in many cases, we transfer folks to the Multnomah County Crisis Line or other responders and community providers. So we do have some experience, and we do have existing knowledge in our knowledge base about community providers and how to best refer. But as Director Myers is stating, we certainly want to default to protect people's safety. And if there is a situation that could be considered an emergency, we're going to get that community member over to 911.
Got it. And, you know, Bob, I may let you chime in a little bit on how referrals work from 911 when something's not emergency. It might be relevant to this discussion, just so.
Yeah, absolutely. Thank you. I'm Bob Causey, Director of BOEC for the record. And yeah, I listen to our call takers a lot. And whether it's 911 or non-emergency call answering, we take a lot of calls, particularly on non-emergency, that end up being referral calls. And now because we have the 311 program, during their hours, our call taker can transfer them directly to the 311 program and refer them rather than duplicate services. What we used to do was provide a lot of the same information that 311 provides. Now we're not having to do that, so that has simplified things. The problem is we're still getting those calls. We're still getting those calls on the non-emergency number, and we really don't need them. So a lot of that has to do with the public education campaign, making sure the community knows which number to call under which circumstances, and also recognizing that not only us at BOEC, but the 311 program provides services for the entire county. So we're taking calls from Corbett, from Gresham, Troutdale, et cetera.
Got it. So in just honing in on 311 capabilities, and again, I'm going to use 311 here and the CSRN somewhat interchangeably because we still don't know we're going to have a 2 or 3 number system under this. Do we envision, what is the current roadmap for 311 to ever have dispatchers? Is that part of the plan? Is that budgeted? What's the roadmap look like for that? Or is that off the table for 311 currently?
So we are exploring expansion of services to include some dispatch functionality for city services. So we're in conversations right now with the PBOT Maintenance Operations Service Dispatch Program, which actually dispatches for a number of different maintenance crews. That's probably the primary place where we're looking at actually taking a call, triaging it, routing it, and determining whether somebody takes action in the field.
And that's super helpful. And I think just as we look at long-term plan, long-term architecture, you know, having trained dispatchers for medical, for mental health, anything that's borderline emergency ends up becoming a requirement, right? And one of my concerns would be, are we creating a duplicative dispatching system outside of BOAC is that actually more efficient or less efficient in the long term? And I at least would want to ask.
Yeah, I think I'm free to comment on that and say it would be less efficient, and we should not do that. I think we should not be introducing any kind of architecture, as you described it, that creates a duplicated effort. And that as we build this out, if we are to do this, I think we need to have a lot of caution in not doing that. The whole idea here is to simplify, while at the same time reallocate those calls that make good sense. And it has to make good sense. We can't play around on the margins where, well, this one might work, but there might be a chance this person went back in an ambulance code 3 to a hospital. Like, we can't take those risks. So where it's very clear that this is the right call to reallocate, then I think I recommend we talk about that and think about that. I don't think we should, the recommendation is not, and I can just say that from my own personal experience, to start putting certified, qualified call takers and dispatchers in 311 as well. That was not the intent. I would think we should avoid that.
And just to calibrate expectations, that makes perfect sense to me, Mike, is that when we're talking about reallocating calls and how they come in the system, that's one part of the burden.
That's
and
right.
then dispatch is the other. So I think we're going to find strong alignment on simplifying to the community. We need fewer numbers. It'd be great if it was 2. If we have to live with 3, that's awesome. I think we're going to see across the board agreement and hope in that respect. But at the end of the day, we're still going to have a dependency on BOAC dispatchers to send those calls out the right way, right? And so just as we're looking at the get here, I think that's an important piece when we're talking true dispatch. I think that I'm going to turn it over to my colleagues for questions. I'll have some more on the other recommendations, but I hogged the mic for a while, so I'll let others talk.
All right, Commissioner Maps.
Thank you, Mr. Mayor. I want to thank everyone who presented today, and Mike in particular for taking on this very important project. I have lots of questions. Why don't I start with this? One of the things that I found a little bit confusing and surprising in the report is the way you conceptualize the non-emergency number. In fact, it doesn't get discussed a lot, although I think it's the key to actually fixing a lot of our dispatch problems. So maybe I'll kick it over to Mike and ask, we have 911 and we have non-emergency. So is the new system that you're trying to set up basically taking over the non-emergency stuff? Is that what you're saying? Is that one way to conceptualize it?
I think that's a simple way to describe it. I think I'll ask Director Causey to kind of maybe form up a thought on this. The recommendation would be that we have 2 numbers, and we educate ourselves and the public on how to use those 2 numbers, 311 and 911. So when someone calls with an emergency, this is police, fire, or medical. The emergencies are cardiac arrest, strokes, gunshots, falls from greater than 20 feet, all the things that we would say were a typical emergency, go to 911, and then individuals making a decision at home, this is not emergent, they would call 311. And Bob, in hoping to answer Commissioner Maps' question the best we can, how does the non-emergency number, and I assume that's a 7-digit number, would that number, we didn't talk about this, would that number go away?
So I've spoken of this before with this board, and this is completely my vision. I'll be honest and upfront about that, because what I want and what I get are often 2 different things. But what I envision are 2 numbers for the community, 911 for emergencies and 311 for everything else. And I've said that a number of times, and what I'm envisioning by that is if there is a non-emergency situation, and we are going to educate our community about what an emergency is and what a non-emergency is. And if the community is educated adequately, they will know to call 311. In that particular case, that 311 call taker would recognize this needs, let's say, a police dispatch. Then that caller would be transferred through the no longer published non-emergency line. We'd still have it. We still have those lines, but it wouldn't necessarily need to be a public number. that then 311 can transfer that caller to us. Now, that's the simplistic version of this. We also have, and this really isn't in the report because it's a technology that we are trying to implement, and that's for our non-emergency call answering that we're very close to implementing. Hopefully getting that turned on at least for a couple hours a day to test and refine next week, and that's called case service, and I've mentioned that before as well, where a automated attendant will answer the phone on non-emergency, and based on the answers, using artificial intelligence, and that's kind of a scary word for us at times, but using artificial intelligence will determine if that caller needs to speak to an actual call taker, or if they can get that referral information directly and transfer the caller to 311. Now, presuming that this test goes well and that it really is a good solution for BOEC, I would determine that that could be an option for 311 across the board, where the caller then calls 311, they get that AI attendant, and it's smart enough to know, okay, I'm going to transfer you to BOEC, or I'm going to transfer you to 311, or provide the information that you need right now. The system actually texts information to the caller that they need, and it will connect them to various websites for web reporting, or give them information that they can just have on their phone directly. Again, that's not really part of this report, but that is kind of part of what's going on in my mind.
Thank you, Bob.
Can I jump in there? And Bob, thank you so much for that clarification. Let me ask a follow-up question. So in your vision for the future and your idealized future, and I recognize your idealized future is not completely reflected in this report before us today, would the non-emergency number, even though it's unpublished, would it be answered by BOEC people, or would that kind of go over to 311?
No, it would be answered by BOEC because those calls would need some kind of public safety dispatch. Even on low priority police calls, we still need to send police. And right now, PS3s or Portland Street Response, whatever would come through that system, it would transfer directly to BOEC so we can process the call because we dispatch those resources.
Okay. Thanks, Bob. Let me ask one more question, and then I'll get out of the way for a little bit. In my head, I divide our dispatchers, whether they be 911 or 311, into two buckets. You kind of have our first responder bucket, and then you have kind of other responders and whatnot. And first responders are cops, fire, ambulance, and historically or recently on PSRs, you know, we basically treat as being first responders. You know, you call 911 and we get them out of there. One of the proposal on the table today would be to take PSR, chat, community connect, and the PS3s and move them over to the 311 dispatchers, I guess you would say. But I guess one of my tensions is, do I think of or how do you conceptualize, or how should we think about who's a first responder and who's not a first responder? You know, should PSR be a first responder thing? Should chat be a first responder thing? Should community connect be a first responder thing? PS3's first responder? Or is it okay to kind of not have them in that category and think of them as community safety?
Yeah, I'll pass this to Bob. I think that, you know, we should settle on a definition at some point on what an emergency and non-emergency is, Commissioner. The traditional definition of an emergency is any call that is imminent danger to life and property is an emergency call. Now, in that, you know, that simplistic definition, is any call that Portland Street Response runs on an imminent threat, danger to life and property. Is anybody dying in the next 10, 15 minutes? I think we could probably argue that a little, but my gut instinct is to say, no, it's not an emergency. I'm standing at the train station across from City Hall to take the train home, and the TriMet information's down. So on the screen it says, call 911 if you have a problem, or go to TriMet, the website. Like, no, there's no imminent threat to danger to life or property. And we have a lot of cleanup, and it's going to take a lot of discussions. And any gray area we should put in the parking lot. We shouldn't do it until we're really ready, because we can make mistakes. And you may, in the end, decide, you may just say, no PS3 responder gets dispatched out of 311, or is it a non-priority? I don't know what we will come up with, but we should have those discussions at least, and then come to a decision on whether we're ready to do it or not. And if we are ready to do it, that's where our bargaining units come in. And there may be an interest from your police chief to say, look, I cannot afford long-term, for the health of my officers, for my staffing commitment, for my ability to keep it funded, I cannot afford to send armed officers to all these calls. I have to figure out a way to allocate more of my non-emergency calls that do not require an armed officer to go to PS3s. He may want that always to go through Director Causey's office. That may be his wish. Chief Boone and Chief Gillespie will maybe make a decision that, I do not need to send a fire truck with a firefighter with a defibrillator to any call where they don't need 4 people on that engine. It's okay to send American Medical Response by themselves. Sure. He may want to do that. He may want always that decision to come out of a call taker out of Director Causey's office. And but I think we have to have that discussion, Commissioner, at some point, really in depth. Because there are medical directors involved here, the county's involved. I mean, this is not just our sole decision here. And there are personal interests of our bureau chiefs, who really should be the ones making the final decision. But we do need to push the discussion, and it needs to be had. Because I see a day, if we do not do something, the call volume is managing Director Causey, the call volume is managing our police chief, and the call volume is managing our fire chief. A day doesn't go by where we don't see a press release from somebody that says we couldn't make the call, we couldn't get someone there because we're just too busy. And staffing alone will not do it. And at some point, if as call volume continues to rise, and if all we're going to do is just allow the calls to come into 911, and we're just going to keep adding more work onto our police department, keep adding more work onto our firefighters, at some point, you can't fund it, and they can't manage it. So I think we just need to pick, 1 or 2 or 3 topics of discussion and just start having hard discussion about it. And it's going to be hard. It's going to be challenging, and not everybody's going to be on board. But we do need to have those discussions. And I think it starts with what you're suggesting, Commissioner Maps, right now, is what is an emergency and what is not. We need to have that discussion.
Thank you, Director. I know I said this. Let me make a statement here, and then I'll cede the floor for a little bit. As everyone in the room knows, I used to be the commissioner in charge over at BOIC, a true honor, and I still miss those folks and also think Commissioner Gonzalez is doing a great space in these jobs. One of the things I think I learned in my time there, or I've come to believe in my time there, that one of our structural flaws is that we have put BOIC in charge of both 911 and non-emergency. We basically get 500,000 911 calls, we get 500,000 non-emergency calls. I think those non-emergency calls need to not even come into the building, although I think I heard Bob say something a little bit different, so I want to have more discussion because he's the true expert there. But I think we actually do a great job of, although we're overwhelmed, I think we do a good job of dispatching our emergency dispatch, our emergency first responder folk. I think our 911 call dispatchers should not be in the business of the non-emergency calls. I think that's the system that we need to set up. And I appreciate the report today that we have, because I think it's moving us in that direction, but I think there are a lot of details that we still need to think through. And with that, Mr. Mayor, I'll lower my hand for a little bit.
Commissioner Rubio.
Thank you, Mayor. I have a couple questions. You talked a little bit about or you mentioned the network. Can you talk a little bit about who's in that network? You said 60 plus. Is that programs, solely city programs? Are they community city? I just want to get a picture of what kind of things are going to be in that network. And then second, you talked a little bit about that maybe PSR or PS3s don't necessarily need to physically move. Can you also expand a little bit on what that operationally would look like, what you're thinking about that, and then how would they operationally plug into this
Yes.
broader network?
Yeah, I think I'll answer the second question, and then I think maybe Bonnie, your team can maybe answer about how you got to 60 and what that makeup was. So the comment that the individual work unit, the PS3, PSR, chat, all the different work units that we talked about, the comment that they do not have to physically move anywhere. So in the example would be, let's say we have 60 opportunities, responders out there that do things that we might need done. They're not all going to physically move anywhere. You know, these might be nonprofits that have an office someplace. I don't even know all of the groups we're talking about yet. We have to go through them all. So I don't think anybody physically needs to move anywhere. Like they don't need to come under Community Safety Division's supervision or direction. There's going to be 60 different groups that are going to be operating, the majority of them outside the city. I do think their contact, as we write the policy for alternative response, that common narrative about how we're managing alternative response, the ability to know what they do and to get them en route, my recommendation is that they're on that network database. They're part of the alternative response platform that the city has. This is everything we have for alternative non-emergency response. A plethora of things, from something high-speed, well-designed PS3s, all the way to something I'm not even familiar with yet. But they're on that database and on that platform. That's the recommendation. As we discuss it, and as we talk about what is the chief comfortable with, what are the bargaining units comfortable with, what are Director Causey and your team of dispatchers comfortable with, we may find that some of the groups don't reside on the network for 311 to actually communicate with. They're best served out of the 911 office. So we need to have that discussion, Commissioner. But that's how I see that network as a database that's collectively supported. We evaluate them from CSD. We make sure they're functional, they have capacity. We make sure they're funded long-term and are stable. Like, we take care of that alternative response platform for the city. Add new groups if new groups come. Help move them off if they don't. You know, that was the vision I had for the network. Okay. Bonnie, can you kind of talk about how you got to 60 and what those might be?
Sure. Well, we would refer you to Appendix G of the report. That's where they are listed. And there is I don't want to say a disclaimer, but a caveat at the top of that. And when we were engaged in the 61 different KIIs and all of that, one of the questions that we asked every group was, what other alternative resources or response units are you familiar with? And from that, they started, people would just list them out. And some of them we found in other discussions, they may no longer exist. They may have changed names. They may have changed structure. They may be within the county. They may be within the city. But for the majority, people still thought most of them still existed. And even though maybe we found out later on. So the Appendix G is unaltered. We didn't go into a lot of detail of what each of these do, but it was feedback from everybody that we talked to of what may or may not exist, and there is over 60 of them. But there is also the street routes document that is listed in the resources, and we know that there are 100 plus just in that document, right? So with what Director Myers is saying of vetting these as they come in, and if they want to be part of the network, referring back again to something similar with Albuquerque, they do have a process. If your unit, your entity wants to become a volunteer or part of their network, they do have a workflow for that. So what he's saying there is true. Another thing I would mention is, if you look in the conclusion of the document, there is a diagram there of the evolving public safety emergency response ecosystem. And what you traditionally see is police, fire, and EMS. There is a fourth bucket to that, which is the alternative response group. And however that is formed, again, the idea is to make sure that there is some coordination. That's why the first recommendation that we have is to provide that change management framework to start having these discussions, start detangling this all of these programs and these well-meaning intended groups that want to help and keep just popping up without that benefit of coordination or know where to go if they want to become part of the solution.
Okay, so my question was more trying to get at, are they contracted city services that we currently fund that then will be part of that network?
That's a great question, Commissioner. No, they're not contracted. I think, no, they're not. They're not currently contracted. To lead on to your question, I don't know yet what that relationship would be. Would it be a contract relationship, a simple, cooperative relationship? Those are all areas that I haven't investigated yet.
Okay, my question is more about the guarantee of service.
Right.
You know, if somebody calls it and it is on our platform.
Yep.
That it is actually
Yeah,
executed.
that is a concern. I mean, what's nice about being in a public sector system is we have a guarantee that if you call, you are getting someone. That's what we do. We will send someone, and typically, we will send someone. So if a resident calls in for service, we want to be able to deliver, and we need some guarantee that we will be able to do that. And I think that should be part of the vetting process: is what is the capacity and what's the ability to actually deliver.
Commissioner Ryan, go ahead, and then I'll go.
Okay,
next.
great. I came into this meeting with not a lot of context, but I was still clear that I thought we should just have two numbers, 911 and 311. I haven't heard anything that's made me think differently, so I thought I'd say that. A lot of it's just on adults can only learn to use so many numbers, so you got to keep it simple. What I liked that you said earlier, Director Myers, is that there's 2 to 3 hard discussions that we should have. You identified one, as I recall, what is an emergency and what is not. Can you tell us what the second and third one might be?
Well, there are probably many tough conversations to have. I think the
But
one,
there's always like the top 3.
I know, yeah, I can do that, yes. I think a couple of critical decisions that have to be made is, do we as a city, if we have 4,500 nature codes, and these are, police, fire, medical call types, and then they're broken down into a myriad of nature codes, do we have an interest in identifying a percentage of those nature codes that are currently being dispatched by traditional services, police officers and firefighters mainly?
Sorry, I was distracted by, what did you say, nature codes?
They're called nature codes. Yes, there are 40, you call in with chest pain, that's, and you have a type of call of chest pain. There are many types of chest pain that you could have, and they can break it down and have whether it be almost non-emergency, I don't know if they have anything related to chest pain, non-emergency, all the way up to a cardiac arrest. So anything that's on that lower end of the scale, are we interested in the city having the discussion on how we might move that off of traditional resources? I think that's a big question. I think your labor groups might have issue with that. Your police chief and fire chief might have issue with that, but we need to have that discussion. I think that's the second big question. I think the third one, and I've always hesitant to bring issues to council that I know are going to have a funding issue to it. But I think we are, the city's in a position today that 311 needs to be 24 hours a day, 7 days a week.
Right.
And that needs to happen at some point. We need to have a plan, I think, to get there. I don't know if we can get there in a year or two. I'm not sure. I don't know. I think this landscape for funding is going to be very tough for the city over the next couple of years, but we should have a plan to get there. This likely can't occur until that happens. There might be a way around it, but that's kind of my assessment as well. I think 311 would have to be fairly robust for this to pull this off.
Yet there's all these other numbers that we hear about that I think most people don't know how to use and if there's anyone there to answer them. But do they exist, and is there efficiencies if we focus on 2? Therefore, we could find the revenue resources for 311 to be built up.
Potentially.
That was a safe answer. Thank you. Good. But I hope that we come out of this with some sort of building and staff recommendations, and then you all have those hard conversations and come back to us. Yeah, that's my 2 cents. Thanks.
One thing I would add to that answer is in terms of what's an emergency and what is not, just going back to some of the key findings, and maybe Bonnie, you would comment on this, that you looked at the top 25 nature codes, which represent 25 out of 4,500 nature codes, but it represents almost 50% of all calls that are coming in. And I've already done some work to recommend these nature codes could go to alternative responders. So while that tough conversation needs to happen, we do have some basis for starting it with the findings in this report.
Absolutely. And then on top of that, starting to define an emergency. And priority 1 and priority 2 calls, which are the highest priority, make up about 17% of all of BOEC's calls. So there is, a broad, it's not the priority 1 and 2s, and it's not the priority 6s and 7s, right? It's that those 3s and 4s and, kind of that murky middle ground there that you want to make sure you get it right, right? And there is some concern where we found, and Gigi, you mentioned it in yours, with priority 6 and 7 calls, we also found that about 1,900 of those came in as priority 6s and 7s, but then at some point in time, something happened that it elevated them and upgraded them to a 1 through 4, right? And then on the flip side, we found about 14,000 calls that started out as a priority 1 through 4, but then once they got on scene, they were downgraded to a 6 or 7. So those are the ones you really need to have the hard discussion that Director Myers was mentioning about, have those assessed. Is there opportunity in there? Is there not? And it's not also about completely allocating a call to an alternative response. What does the co-response look like as well? And that's where in that 33% of an initial eligibility goal, we also took into account about a 10% that you could be in there as co-response. Even on something of a nature code as a shooting, there's an opportunity for an alternative co-response of, if you take the example from the airport a couple of months ago, you engaged TriMet to do evacuations. That could be considered an alternative response and support in a support role, right? So that's not an and or, an or, or one or the other. It is an and in many cases. You're looking to supplement to get the right resources on scene or engaged in a response so that you take care of as many needs as possible.
Great. I'll jump in here, and I'm mindful of the fact we have about 3.5 minutes, so you get extra credit for brevity. So one of the 6 pillars of 21st century policing is officer wellness and safety. And as I look at the model that you've proposed, if we move to this community safety response network, my question is, does that then concentrate the highest acuity calls in the police bureau? And if it does, what does that mean in terms of the health, safety, and well-being of our officers if they're only going from high acuity call to high acuity call to high acuity call, not just high, but the highest acuity calls?
Great question, Mayor. They're already going to all the high acuity calls. The high acuity calls do not stop if we take the low acuity calls off. I get your point
I don't
that a low
dispute that, but
acuity
the
call
question is,
might
do
have
we
an
want
opportunity for them to
institutionalize that?
gain down. I think it's a good question. The police chief raised the same question with me, and I understand that question. The 2 points I would make: your high acuity calls don't go away; they're still there. I think, I'm a fire chief, so I'm not a police chief. From a fire chief, I would tell you, I would prefer that the workload be reduced on a fire shift for firefighters than to keep the workload where it's at so they can run low acuity calls. If I talked to firefighters, when I would go by stations when I was a fire chief, and I said, hey, what if I could get rid of all of the alpha level calls, the low acuity calls, and free up your day? Chief, if you can do that, that would be awesome.
So is that the theory, and not to cut you off, but I'm just mindful of the time, is
yeah.
that the theory behind this then, that there will be fewer calls, so they will be high acuity, but they will not be as
Workload will be
frequent?
reduced,
Is that-
correct.
so
That's
they
correct.
will have time to decompress, if
That's
you
the
will,
intent.
Okay. And I'll just jump to my next one, just mindful of the time. I wasn't clear how CSRN changes the role of PS3s, or if it does change the roles of PS3s?
It does not change the roles. Are you saying roles or rules?
Roles.
Roles. It does not change the roles of PS3. PS3's roles are pretty clearly defined right now. You might find in the future that you would like to see PS3s do different kinds of work that they're not doing today. That would be a discussion with labor on whether they would agree with that and whether the police chief wants that. It does not change the roles now, but if we find during our, as we analyze the nature codes, Mayor, and these calls could go to PS3s, currently they're not allowed to go on those calls today, you would have to have that discussion.
Okay, and thank you, because, you know, I was wondering whether there'd be additional training or certification requirements, but it sounds like that's dependent upon what
It would be
additional-
likely and it would be dependent.
Okay, and then last of all, that there's only a handful of the 60-plus alternative response actors and programs that are currently city-operated, so how does that fit into the CSRN? How do the ones that are not affiliated with the city dovetail with this work?
So it's likely that we will find, I would assume, I haven't looked at all of these yet, I would assume at the end of this, we would want to progress and do that, but I would assume many of them are nonprofit. That would be some kind of public-private, public-nonprofit relationship partnership that would be somehow memorialized in some kind of understanding, as some kind of contract to do work. The question would be, like, how does payment get done? Who pays for this? Are they alone on their funding? The city certainly wouldn't be, I don't think, in any place to start contracting to do work at additional costs. So it would be interesting to see how this would, what the cost structure would be to build these relationships.
Okay, great, and we're 1 minute over, but we did invite the first responders to be here, and they haven't had much room to say anything. I'd be kind of curious to know what your thoughts are.
I'll jump in just quickly. Ryan Gillespie, Division Chief, Portland Fire and Rescue. Director Myers, thank you to your team and Mission Critical Partners for the presentation. One piece I wanted to speak to just quickly is, as we determine what the definition of an emergency is versus a non-emergency, in our line of work, that often can't be determined until after the fact. In hindsight, you can look at a situation or an incident and determine that truly was an emergency or that wasn't. What we count on is Director Kazi and his team and his highly trained dispatchers to intake the information that they get. Sometimes it's very little information, and then dispatch according to the protocols and their matrix to do so. When we respond, we can then determine on scene if it truly is an emergency or not, and we do that to the best of our abilities. And we're able within the dispatch network, the 911 system, to be able to then call for extra assistance, whether it's additional ambulances, police, or downgrade it, call for Portland Street Response.
So does this help or hurt? I can't quite tell based on that.
Does this
Makes sense what you're saying, but.
I think this is a very important conversation to have. I think for the fire side of it, and to answer Commissioner Mapp's question, Portland Street Response and Chat are first responders. Community Connect is more of a follow-up program. So, but with that medical component, we absolutely rely on the 911 call takers and dispatchers to make that determination on which resource to send. So I'm looking forward to continuing to have the conversation, and I also agree that the more we can do to differentiate emergency, non-emergency, have a simple system for the community to follow and call, we need to support that.
Okay, so it sounds like at this point, I don't mean to put words in your mouth, you like the conversation, but you're not yet ready to commit. Is that a fair statement or not?
That would be a fair statement.
Okay, thank you.
Aaron Schmautz, President of the Portland Police Association. I think the thing that's so difficult about this conversation for me is really to the spirit of what your question was. What is an emergency as it relates to police response to matters really is in the heart and mind of the caller. Very often I'll speak to people and they'll say, I know this isn't a big deal, but then this is the most difficult day of their lives. And so ensuring that they have interactions and trust in law enforcement can't just be in the most critical moments. I was meeting today with some addiction folks who are focusing primarily in the Native American community and the Latino community in just kind of response to addiction. And they were just kind of speaking to me about how just everyday interactions with law enforcement have been the thing they miss the most. because it is the biggest barrier to trust as it relates to those critical moments with law enforcement. And if you're trying to build those relationships in crisis, you're not going to be successful. And so, I think this conversation is hugely important, but I also think that the thing that our community is missing the most right now is daily interaction with their first responders and understanding their role so that when they are in crisis, they're not having to try to build that relationship on the fly. So I will always object to police officers only being acute responders. Police officers should be out of their car every day interacting with shop owners and families and learning about what their needs are and ensuring that those needs are filled. They should be bridge builders to secondary type models. They should be hand holders to ensure that people are getting to treatment, people are getting to the services they need. So I 100% agree that these conversations are difficult. Everyone has needs, everyone needs to be heard, but if we get to a place where our police officers are only responding to gunfights and murders and really, really difficult circumstances, we will have a gap that we can't fill in the way that our community trusts and responds to our first responders. So I'm all in for the conversation, but I think we have to be careful about what we're doing here.
I really appreciate your input, and we went over. This was a great discussion. I really appreciate it. And the slide presentation, I think, got to the right issues that we needed to discuss. Obviously, we could continue for another 3 hours. We won't. But this is a really good start, and I appreciate it very, very much.
We appreciate your support. I appreciate you funding the study. And again, thank you for the partners and Mayor and Commission. Thank you for having us today.
Thank you all. We're adjourned.